In the year 2019, the coronavirus disease or COVID-19 has changed the lives of world population. The effects of the disease also should be known to the public so that they are able to reduce the spread of the virus. Therefore, this study hopes to establish a deeper understanding of the effects of the COVID-19 pandemic to the physical and mental health of humans. This study also aims to investigate the level of awareness of the public towards the outbreak. Our group members have done both primary and secondary data collection through questionnaires and literature review. For the questionnaires, we have used Google Form to do an online survey. There are 15 questions in total. This survey was divided into two sections. The first section contains 5 questions about the respondent personal details. The second section of the survey has 10 questions about the respondent understanding about the first one, the effect of COVID-19, second, how to cope with the effect, and third, their general views about Malaysia's recovery rate during this pandemic. A total of 54 respondents were recorded and the data of the response was analyzed using Google Excel. Before we go on to the result, let's find out what exactly are the effects of COVID-19 to the human health.
For this section of the video, we are going to discuss the effects of the COVID-19 pandemic on physical and mental health. All the information was obtained and studied from past academic journals and articles. The most common symptoms of coronavirus to a human body are basically fever, fatigue, dry cough, and anorexia. Gastrointestinal symptoms such as diarrhea, nausea, vomiting, and abdominal pain are also the symptoms of the coronavirus. A person with weak immune system, especially on the elderly, has high tendency on getting the virus due to their weak immunity compared to a healthy person and the children. These are all the physical effects to the human body. Then what about the mental effects? The most common psychological stress during the pandemic outbreak of COVID-19 in Malaysia are anxiety, fear, and depression. This applies to not only the patients infected by the disease, but also the non-infected community in Malaysia. During the movement control order in Malaysia, which limit the people movement and social activities in the public, this can risk the non-essential business. Thus, many people have become jobless. This group of people will have the feeling of fear and insecurities that eventually disrupt mental health. However, the most affected group of people during the pandemic are the healthcare workers, where they mostly experience depression, anxiety, insomnia, and distress. The question to be asked here are, how do we cope with all these effects, and are the public really aware of the severe effects this disease can bring? The next part of this video will discuss the answers based on the results of our surveys.
Now we'll talk about the findings and discussion. Question 1 until 5 ask the information about the respondents, which are age, gender, region, residence area, and education level. Based on the survey, all of them are in the age range of 18 to 30 years old. This is because the survey is limited to only UTP students. All 54 respondents have complete or are still pursuing tertiary education, as the highest level of education is bachelor's degree or diploma. This proves that the respondents are well educated and have a deeper understanding of this global pandemic, and have no problem in answering the survey with critical thinking. Based on the results, 68.5% of the respondents live in urban area, while the other 31.5% live in the rural region. Based on the national statistic for COVID-19, it says there are more COVID cases in urban areas. Half of the respondents are from the are from the north region of the nation, which is Kedah, Perak, Pulau Pinang, and Perlis. And those regions are with low COVID-19 cases. The second highest percentage, which is 37.8%, is in the central Malaysia, which is Selangor and Kuala Lumpur, with the most COVID-19 cases in Malaysia, while the other 22.2% are from the south, which is Johor, Melaka, Pahang, the east, which are Kelantan, Terengganu, and the Borneo region, which is the Sabah and Sarawak. All of the respondents have witnessed the rise of COVID-19 infection in their respective region, and because of this, they can answer the survey comprehensively.
In the second section of the survey, questions 6 until 8 ask the respondents about their notice of the effects of the disease to human health and whether they agree that COVID-19 affects humans regardless of their age. All 54 participants showed their awareness about the COVID-19 effects. All of the respondents also agree that the disease can bring severe medical effects to human health regardless of their age. The past statistics have shown that the elderly and young are more susceptible to dire health conditions if they are infected. However, even the non-elderly with past medical implications are at risk. Thus, it is evident that age plays a small part in determining which group of people are more vulnerable to the virus. Questions 9 and 8 ask the respondents if they had direct or indirect contact to COVID-19 patients and how they had observed the mental and physical health of the patients. 9.3% of the total respondents have acquaintances that are currently diagnosed with COVID-19. In terms of mental health, the patients are observed to have their morale down and experiences stress due to not only their health condition, but also external factors such as the economic disputes the country currently faces. A respondent observed that the patient's weak immune system is caused by their old age, and another respondent checks the patient's cough to know if the patient is still experiencing the critical phase. The answers show that the respondents are well versed about the mental and physical health effects of COVID-19. This is due to because they have closely monitored the behaviors of the patients. Mental health is a serious issue during the pandemic, and it does not only affect the patients infected with the disease. Hence, question 11 inquire about how the respondents take care of their mental health during quarantine. Majority of the respondents agree that spending quality time with their family members and drinking lots of water help in maintaining their mental soundness. Other ways to cope are by listening to music, eating healthy food, and practicing yoga or meditation. Question 12 asks the respondents about their practices in their lifestyle to avoid the disease. The responses show that the respondents are practicing the 3W, which are wash, wear, and warn. The majority pick wearing proper masks, maintaining physical distance of 1 meter, and washing hands with soap regularly as their habits during the outbreak. The respondents have also cancelled their outdoor activities and chose to do indoor activities such as doing workout in their homes. This proves that the respondents are taking proper precautions to make sure they are not badly affected by the disease.
Lastly, I will talk about question 13, 14, and 15. So all of these questions are mostly talk about the views of the public to the recovery rate in Malaysia. This is because we are curious on how the respondent would answer, and the answers are mostly satisfactory and contribute to our research. So question 13 is asked about the respondent on how satisfied they are with the steps taken by the government on reducing the number of cases. From this shows that 36 out of 54 respondents responds with 5, rated 5, and while the rest remaining of 18 out of 54 rated 4. This shows that they are very satisfied with the government and appreciate all the tremendous efforts taken by the government and the frontliners on reducing or controlling the spread of the COVID-19. Next is question 14, which asks about the respondents' knowledge about the recovery rate in Malaysia. This shows that 90.7% of the respondents are fully aware that the recovery rate in Malaysia are among highest in the Asian region. This high percentage of the respondents can be attributed to the transparency of the Ministry of Health about the COVID-19 statistics. The cases of access to the news about the pandemic through the television, radio, or other media's resource can be also assured that the citizens are up to date with the current situation in Malaysia. So lastly, question 15 asks about the respondent opinion on how Malaysia dealt with the efforts on controlling the pandemic, which is the question on how do you think Malaysia can achieve a high rate recovery in here. The top 2 recovery rate is by implementing a movement control orders or MCO, and also the second top is compliance on the standard operating procedure or SOP. Aggressive testing to the polymerase chain reaction PCR or swab tests also help to manage on controlling the pandemic in Malaysia. And the last answer or also on donating the personal protective equipment to the frontliners of the country were also aided in handling on the outbreaks.
Okay, I will talk about the conclusion part now. To conclude, the survey we carried out yields promising results that can be used as proof to confirm all of our hypotheses, which are there is 3. One is COVID-19 causes dangerous implications to humans' health physically and mentally, regardless the age groups. Second is the best way to cope with this COVID-19 are the 3W, which are wash hands with soap frequently. Second, wear masks properly. 3 is warn while avoiding 3C, confined spaces, crowded places, and close conversation. The last proof confirm of our hypothesis is Malaysia achieves high recovery rate mainly due to MCO and the compliances of Malaysians to the SOPs. From this survey, we know that most people realize how dangerous this virus is, and they took all safety steps and measures. We hope that through this research study, we are able to remind everyone to remember the consequences of this disease. The success of decreasing the number of new cases depend on the cooperation between government and citizens. Despite the new clusters and rising cases, we can only continue to pray and hope that the battle against COVID-19 will come to an end with us at the winning side. #stay safe, #2 kita jaga kita.